Hello everyone and welcome to this lecture on how to write title, abstract and list keywords as part of the series of lectures for the manuscript writing course. I assume that if you are viewing this lecture, you have already written up your research work in the form of a detailed manuscript or a report under the heads of Introduction, Materials and Methods, Results and Discussion. This is the right time for you to think about writing and summarizing your entire manuscript in the form of an abstract, finalizing an appropriate title for your research work and listing keywords. Having said that, the specific learning objectives for today's session are to enable you to write a relevant title for your manuscript, to be able to describe the principles of abstract writing, and to be able to list relevant keywords. First, let us look at the first objective of today's session, that is to enable you to write a relevant title. What is the purpose of writing a good title? Should we at all spend a lot of time on writing a good title? Yes, of course you should. Why? Because the title of a manuscript is the first introduction to your research work, both for the readers as well as for the reviewers. And many a times a good title induces the person who's reading your research work to read the entire manuscript or the abstract. Also, a good title ensures that your manuscript is appropriately indexed in the indexing databases like PubMed or Scopus, and that your research work would be easily retrievable by any person who is searching related to your research area. This also ensures that your manuscript may be read and cited by several of your peers. What are the attributes of a good title? A good title should neither be too long nor it should be too short. It should be a concise one and it should contain detailed information about the body of research that you have done. It should talk about who were the participants of your research, what was the health related area that you were studying in your research, what are the interventions that you had given, if any, what were the comparators, what were the key outcomes. Also, it is a good practice to explicitly mention the study design as part of the title. When you are writing the title, ensure that the terminologies that you use are scientifically accurate and well valid. Also, be very specific about what is your research work. For example, do not write titles like Vitamin D and Pneumonia. They do not make any sense and does not give a clear idea of what your research work is all about. So, instead of writing vitamin D and pneumonia, if you write vitamin D deficiency and risk of severe pneumonia in children, then that is more specific and tells the readers a lot more information about what was the research work that you had done. It is also a good practice to ensure that your research title is interesting enough to pique the interest of the audience so that they would go ahead and read your abstract as well as the full manuscript. The next thing that you need to think about is it a good practice to state the results as part of your title? Now, many of you, while going through journal articles, you would have seen that authors do write the results in the form of a title. Now, this form of writing a title is called as a declarative title. For example, a declarative title may go like this: a 7-day antibiotic therapy is more effective as compared to a 10-day antibiotic therapy for neonatal sepsis. Now, is this a good way of going about writing your title? What this sort of a declarative or stating your results title does is, it may pique the interest of the audience, but the reviewers would understand that there is a certain amount of intrinsic bias that you have about what could be the answers to your research question with which you set out to do the research. As a result, it is not a very good practice to state results in the form of your title. What are some of the other things that you should usually avoid while writing a title? Never ever use abbreviations as part of your title. For example, if you're using an abbreviation called ASD, to a cardiologist, ASD could mean atrial septal defect. To a child psychiatrist, ASD could mean autism spectrum disorder. So, a common and well accepted abbreviation like ASD is what a cardiologist would think, but then a child psychiatrist would interpret it differently. So, do not write abbreviations as part of your title. Write the full form, expand it, and then maybe you could add the abbreviation you want to use in the parenthesis next to the full form. Please avoid using interrogative connotations in your titles. People have done research which has shown that titles which describe the research question, though people are more likely to read such manuscripts, these manuscripts are less likely to get cited. Do not use all capitals while you're writing a title, because the conventional way of writing a title is in the sentence case. Writing all capitals may appear very loud and rude to certain readers and reviewers. Let us look at a few practical examples. Look at this example, pause the video for a minute and think about if this is a good title for a piece of research work. This title reads like this: Video game playing among preschoolers, prevalence and home environment in 3 states of India. Now, if you think for a minute and analyze this title, you would understand that video game playing is not a very good accurate terminology for internet gaming disorder. Also, the title does not make us understand what is being studied about the home environment. This makes you understand that the title needs certain refinement. A more refined form of a title could be Prevalence and Determinants of Internet Gaming Disorder Among Preschoolers in 3 States of India, a cross-sectional study. This title clearly mentions what is the area that you want to research, who is the target population that you are looking at, what is your research question, where was it done, and what is the study design. Now let us look at another example. This example says, does TIPS help in preventing rebleed in cirrhotic patients? Again, if you would take a minute and analyze this title, you will be able to observe that there is an abbreviation. If you analyze this title, you would understand that TIPS is not a very well-known abbreviation, especially among non-gastroenterologists. Also, we are not understanding whether this is an interventional study or whether this is a cohort study or whether this is a quasi-experimental study. So this title needs a certain amount of refinement. A better title would be one which elaborates and writes in full form what is TIPS, tells us what is the comparator, whether it was a randomized trial or not, what was the outcome of interest, and what is the patient population that we are looking at. So a better title would be Effectiveness of Transjugular Intrahepatic Portosystemic Shunt, which is TIPS, versus beta blockers in preventing variceal rebleeding among advanced cirrhosis patients, a randomized control trial. So that brings us to the conclusion of the first objective of today's session, that is how to write a relevant title. I hope that now you understand what are the attributes of writing a good title, what are the do's and don'ts, and how you could refine certain titles that you are working on for your research work. Now let us move on to the second learning objective of today's lecture, that is to describe the principles of writing a good abstract. Again, we begin with the question of whether abstract is an important section of your written manuscript. The answer is yes, of course. An abstract is perhaps the only part of the manuscript that readers or reviewers may be reading about your research. So, a good abstract often induces the readers as well as the reviewers to go on to read your full manuscript or at least the abstract part of your manuscript. In the case of conference abstracts, usually only a portion of your research work is presented as a conference abstract. Sometimes authors may not go on to write an entire detailed manuscript based on the conference abstract work alone. So, conference abstracts that you present perhaps could be the only published record of your work. What are the basic aspects of an abstract? An abstract is a gist or a condensed and concentrated summary of the detailed research work that you have written up in the form of a report or a manuscript. The abstract should be consistent and should be in line with the detailed report or manuscript that you have written, by which I mean that your abstract should follow the same order of information that goes on in your detailed manuscript, and it should also include information only from the source report. Do understand that abstract is a standalone document. By that I mean that if a reader reads only your abstract, he should be able to get all the details related to your research work which are vital and important. That is, he should be able to know what was your research question, how did you go about answering the research question, and what were your key results, and then what were your conclusions and recommendations. All of this a reader should be able to understand just by reading your abstract, even without going on to read your full manuscript. Having discussed the basic aspects of an abstract, now let us discuss how conference abstracts are essentially different from manuscript abstracts. Now, usually a conference abstract is something that the author writes from a portion of their research work or from the interim analysis of their research work with the only objective to gain acceptance to present as part of a conference. So generally, conference abstracts may not be based on the final analysis, but may be based on a preliminary analysis or an interim analysis. But it should be understood that conference abstracts also remain available in conference proceedings and may be quoted by several people who are working in your same area. As a result, a conference abstract preparation also needs rigorous methods and it should not be taken lightly. In contrast, a manuscript abstract is something that is written primarily to summarize all the key elements of your main manuscript. So usually your manuscript abstract is based on the final analysis and also is going to be indexed in several abstracting services like PubMed, Scopus, etc. As I previously mentioned, always you must keep in mind that abstracts may be the only part of your research work that readers or reviewers may be reading. As a result, your abstract should contain sufficient accurate information related to your research work so that people may understand your key conclusions and recommendations. Let us move on to understand what are the various steps in preparing an abstract. So the first step in preparing an abstract is to choose a topic. This holds good both for conference and manuscript abstracts, but it needs special attention, especially for a conference abstract, because a manuscript abstract is usually written after you write your full manuscript, whereas conference abstracts generally are written when your research work is in midway or you have just completed an interim analysis. So always think about what all research questions you are going to address as part of this abstract. So choose your topic wisely. That is the first step in preparing an abstract. The next step is to review the data that is available or to review your detailed manuscript and understand what are the key elements that you are going to work on in this abstract. The third step in preparing an abstract is to look at the rules of the journal and conference and then adhere to the rules, be it the word limit or be it the structure or be it the requirement of an additional table or the requirement of an additional video or the requirement of an additional graph. After having reviewed the rules of the journal and the conference, the fourth and fifth step is to extract relevant information from your data and manuscript and to organize the relevant information that you have extracted within the outline of the abstract as prescribed by the journal or the conference. So, having understood that there are multiple steps in preparing an abstract, you may know that you will not be able to write a very good abstract at one go. So, one of the important things that you need to understand about abstract writing is do not hesitate to keep on writing, revising, rewriting and revising your abstract. So the final version of your abstract would be something that is holding key information about your full manuscript or your full body of work and also ensures that the reader's interest is spiked so that they would go and read your full manuscript. Let us now go into a little bit detail about each of the steps that we have elaborated in the previous slide. Step 1 is all about choosing the right topic for your abstract. There are certain do's and don'ts when it comes to choosing the right topic. So what are the do's? Always choose topics which are addressing research questions where you have enough data, the analysis of that data is complete and you have got key results either in the tabulated version or in the form of graphs and you know that you have conclusions and recommendations which are clear and which have come out from your results. Another important aspect of choosing the topic for your abstract is obtaining relevant clearances. It is a good practice for you to always take the administrative clearance from the reporting authorities within your institution, and also to take academic clearance, be it from your thesis supervisors or from the other contributors of your research work, so that everybody is on board and knows that such an abstract is being written up either for a conference or for a manuscript. So before you submit your abstract to the conference, you need to take all these clearances and only then submit your abstract. Now let us look at some of the don'ts that you should not do while you're choosing a topic for a conference abstract. Never ever present a topic which has already been presented in another conference. Do not choose a topic that already has got a published manuscript, because an abstract is already written. The idea of presenting in a conference is to disseminate your results, and if there is a detailed manuscript that is already available, you cannot go and repeat the same information in a conference. Do not choose a topic when the analysis is not yet complete. If you are not sure about the key conclusion or result, then do not choose that research topic for presenting in a conference. And in case you do not obtain relevant administrative clearances, or if your peers are not in support of you writing up this research work for a conference, then please do not present this or choose this particular topic for a conference presentation. The step 2. After having chosen the topic, the next important step is to review the data or the detailed manuscript that is available with you. If the written report is available, you need to go through and review the report so that you can pick up key elements that could form part of your abstract. If your report is not yet complete, then you need to review your protocol, find out what data you have relevant to the topic that you have chosen for the abstract, analyze that particular data, put your results in the form of text, tables, graphs or charts, whichever are relevant, and identify key pieces of evidence around which you will build your abstract. Make sure that you have a logical conclusion to the research question that you have posed in the topic, and then go ahead to think about what recommendations that you can write based on the results that you have observed. After having reviewed the data that is available with you in relation to the topic that you have chosen, the next important step is to review the rules prescribed by the journal or the conference for writing the abstract and submitting it. These rules could be pertaining to the structure of the abstract that you have to write, whether there is an imposed structure in the form of introduction, methods, results and conclusion, or whether the journal mandates that the abstract should be unstructured. Also, these rules would tell you what are the word limits that you have to stick to while writing your abstract. The common word limits that often journals or conference presentations demand is between 250 to 275 words if it is going to be a structured abstract. If it is going to be an unstructured abstract, then usually the word limit is much smaller and may be roughly around 100 words. The way to go about writing an unstructured abstract is to first write a structured abstract, keeping the introduction, methods, results and conclusion in the logical order, and then to edit it and reframe it so that it appears like an unstructured abstract. After having reviewed the rules of the journal or the conference, the next steps are to extract ideas pertaining to your research question from the detailed manuscript that you have written or from the report that is available with you, and also to put these key elements in the outline as prescribed by the journal or the conference. So while extracting the ideas from the report, you need to again go through the report, review the data, identify those key pieces of information that you are going to put into your abstract in the form of either a key table or from a key graph, and then you build logical argument around those key elements. Finally, after having extracted the key elements that you have finalized would be going into your abstract, organize that material within the abstract outline. The abstract outline, as you are well familiar by now, includes the introduction, methods, results and conclusion. With this slide, we have understood what are the key steps in writing up an abstract. Now let us look at a couple of examples from published work which show us a structured abstract as well as an example of an unstructured abstract. This is a published abstract from Lancet Public Health and gives you an outline of how a structured abstract would look like. A structured abstract will have an introduction and a background section. It would have a materials method section, a key results section, and a conclusion section. Whereas an unstructured abstract, as in this case from the Medical Education Online Journal, shows you that the abstract does not have clearly imposed subdivisions. Whereas if you would pause the video, take a minute and read this abstract, you will be able to understand that though there are no imposed subdivisions or imposed categories in this unstructured abstract, the authors begin with describing the background of why the research has been done. Then they go on to discuss what is the objective of the research work. Then they tell you how or what were the methods that they had followed to address the research question, what were the key results that they had observed, and what are their key conclusions and recommendations. So though there is no imposed structure in an unstructured abstract, as I told you previously, even unstructured abstracts generally follow the same flow of introduction, methods, results, and discussion. Having seen examples of published work of how structured and unstructured abstracts look at, let us delve a little bit in detail and see what should be written under each of the imposed heads of a structured abstract. First, let us begin with the background section of an abstract. In the background section of the abstract, the most vital piece of information that should be written in the background section of an abstract is the information pertaining to what research question you are addressing in this piece of research work. And also you need to mention what were the reasons that led you to conduct this piece of research. If the word limit would allow you, and if it is possible for you, then you could also mention a couple of lines about the importance of the topic that you're researching, or if there is any other background information that you would like to add to the introduction segment. Having understood what should go into the background section of an abstract, now let us look at a practical example of writing the background or introduction segment for an abstract. Now this example pertains to investigating an outbreak of gastroenteritis that occurred in a specific region in India. So here we are trying to tell you what is the order of importance and what is the order in which the details are presented usually in an introduction. Usually in an introduction section, many of the authors, the first line that they write pertains to what is the importance of the topic that they are trying to address. The second line that they would write is what are the reasons that led them to conduct the study, and the third line that they would write is what is the objective of the study. But as we had seen in the previous slide, you know that the most important aspect of the abstract introduction section is to make the reader know what is the objective of your study. So if at all the word limit does not permit you to write 3 lines in the background section, then the one line that you must give related to this outbreak investigation is the first line that we have mentioned. That is the objective of the study. That states, we investigated the outbreak to identify its source. Suppose if the word limit permits you to elaborate, then you can go on to say what is the importance, that is, festivals are common causes of foodborne outbreaks in India, and then you can go on to say what are the reasons for which the study was conducted. That is, they had observed a cluster of gastroenteritis cases among the guests who attended a wedding. I hope that that is clear. The methods paragraph in the abstract actually should mirror the same format of the methods paragraph that you write in your detailed manuscript. By which I mean that the methods paragraph in your abstract section should also elaborate what was the study design that was used to address the research question, what was the case definition that the authors had used, who were the participants of your research, what were the details of the interventions or the comparators that were given, how did the data collection happen, what type of analysis was done, and whether there was any additional pertinent information related to the method section like environmental assessment, etc. Those also need to be forming part of the methods paragraph of your abstract. For example, this is the method section of the same investigation of the gastroenteritis outbreak that I was detailing when we were discussing the background section. Pause the video for a minute, take a look at this method section. Having gone through the method section, I am sure now you would understand that this method section gives you information about what was the case definition used for gastroenteritis, what was the analysis that the authors had done, what were the participants who were included in this particular study, and what is the design that was employed, what were the methods of data collection, and what were the lab investigations and additional information that was collected as part of this outbreak investigation. So to summarize, the methods section should detail out how was the study done, who were the participants, what sort of data was collected, how was that analyzed, what are the laboratory methods if any, and if there is any other pertinent information you may want to give that as well in the abstract. All this provided that the word limit permits you to do so. Moving on to the results paragraph of an abstract. The results paragraph of an abstract should summarize all the key result informations. The first line usually should talk about the response rate from the participants to your study. Then you should detail out the characteristics of the participants so that the readers are aware to whom the results can be applied to. The key measures of disease frequency like prevalence incidence should be mentioned, and what were the results of univariable and multivariable analysis if any that was done. If there were any additional investigations, then you should mention all of that in your results paragraph. Mind you, the results paragraph should address the research questions that you had posed or the objectives that you had mentioned in the introduction section. Also, the results paragraph should be the ones from which your conclusions and recommendations are derived from. Continuing with the example of the outbreak investigation, a sample results section should usually look like this in an abstract. The first line is going to give you the response rate, which says, of the so many guests that we were interviewing, so many responded to our survey. What were the characteristics of the subjects who were included? How many of them were male, female? What was the median age? How many of them had gastroenteritis? That is, what is the incidence of gastroenteritis in the study? What sort of analysis was done? What did we find out in the univariable and multivariable analysis? And was there any additional investigation done to identify what was the specific causative agent of the gastroenteritis? In this case, it is a Staphylococcus toxin. Whether any additional probing was done to identify what was the source of this staphylococcal gastroenteritis that is happening. In this case, they identified that unhygienic practices, that is leaving the fish egg batter at a room temperature for 5 hours by a food handler who has chronic staphylococcus infection, led to the outbreak. Your results section should be in line with your research objectives. The research objectives of this outbreak investigation was to identify the source of the gastrointestinal outbreak. The conclusion section of the abstract should often provide the result for the key research question that you have posed, and it may be written by integrating multiple lines of supporting evidence that you had written in the results section. The key recommendations or actions that need to be initiated after this study need to be derived from the results that you have obtained as part of your study. So, never ever give a generic conclusion or a generic recommendation in your abstract. So, limit the conclusion and recommendation directly to whatever evidence that is supported by your data. A good example of a conclusion section for the outbreak investigation is like this. The Staphylococcus foodborne outbreak was caused by an infected food handler with poor food hygiene practices, which is the key conclusion that directly answers the research question of what is the source of the outbreak. The key recommendation from this, therefore, would be that public health authorities should work with food handlers to improve food safety during large gatherings like weddings or during festivals. I hope with this example of outbreak investigation, you have understood what should be written under each of the sections of the abstract, that is the introduction, the method section, the results section, and the conclusion and recommendation section. Having seen what should go into the various sections of a structured abstract like the background, the methods, the results and discussion, one of the key rules that you need to remember is, overall, throughout your abstract, the primacy of data should be maintained. You should not begin writing your abstract without having data, and most of the words that you write in the abstract should be revolved around the data that you have generated as part of your research work. This means that you will have to revise your abstract, minimize and cut down all the words that may be unnecessary. Often authors write words which do not provide additional information, like "it was interesting to note that" or "more research is needed." Avoid using such unnecessary words which do not provide additional information to your abstract. Be specific while writing your abstract. Avoid vague and unclear statements. Always use an active voice because an active voice provides more clarity. For example, instead of saying "a descriptive study was done," you could say "we performed a matched case control study." So this is a more clear one and also is written in an active voice. Specify the tools that you had used for measurement very clearly, because these tools could be used by other researchers who are working in the same area. Always present data clearly before concluding from the data. When you're doing the outbreak investigation that I was mentioning to you, don't start a statement saying that a point source epidemic was noted. Rather, describe very clearly that the cases rose rapidly and fell rapidly within a short period of time that was being investigated. Allow sufficient time for revising your abstract. This is one of the key aspects or key principles of abstract writing. You must have plenty of time and should not rush into writing your abstract, because abstract is one of the most important aspects of your manuscript, and you need to write and rewrite because your abstract should contain all the relevant, accurate information. It should summarize your entire manuscript in a short form in 250 to 275 words, while conforming to the rules prescribed by the journal or the conference. So revise, rewrite, revise, revise, revise. That is the advice that I would give to you. Do not hesitate to write multiple versions of your abstract. Do discuss and take advice from your supervisors, from peers who have contributed to this research work. So after many revisions, you would come up with an abstract that is a very good one, provides succinct summary of the detailed research work that you have done, and also is fully conforming to the rules of the journal that you are targeting or the conference where you want to present the abstract. Before final submission of the abstract, always seek academic clearance as well as administrative clearance so that you are all done and set to submit the abstract. A lot of the journals now also require you to provide a graphical abstract. Being in the age of social media, we understand how informative visuals can be used, be it on Twitter platforms or Instagram platforms, to disseminate your research results quickly. So a graphical abstract is nothing but a pictorial or a visual summary of the research work that you have done. It should be designed in such a way that the readers would be able to rapidly understand what was the study design that you employed to address your research question and what are the key take-home messages that you have derived from your research work. Several journals have got specific guidelines on how graphical abstracts should be presented. I'm just giving you an indicative example of how an effective visual abstract should be. Now look at this visual abstract for a study that looked at the impact of treating iron deficiency anemia before major abdominal surgery. Now, as is seen in this visual abstract, it is very important that within the visual abstract you find space for summarizing the key research question. The next important aspect that a visual abstract must have is it should explicitly mention the outcomes of the study that you're trying to see. So some of the outcomes that this particular study looked at are decreased need for blood transfusion, shorter hospital length of stay, and also they looked at recovery of hemoglobin post-discharge. Now each of these outcomes are also visually represented so that the viewers or the readers are immediately attracted to see and understand what this research is all about and what did the results show. Look at the bottom section of this abstract. The bottom section also gives explicit data related to the outcome. If you look at the outcome pertaining to decreased need for blood transfusion, the decrease was observed from 31% to 12% when iron deficiency anemia was treated before major abdominal surgery. Similarly, for the other outcomes pertaining to hospital stay and pertaining to the recovery of hemoglobin post-discharge, similar outcome data has been explicitly mentioned. So whenever you are giving a graphical abstract, the outcome data should be explicitly mentioned as part of your graphical abstract. Also, it is a good practice to give the citation of the authors and also information about who created the visual abstract. So whenever the journal or the conference where you're presenting demands a graphical abstract, take out time to go through the rules prescribed by the journal or the conference, and usually the journals and conferences also give you a template of how the visual abstract should look like. So go through that template, look at the rules, extract your data, conform to that template, conform to those rules, and create a graphical abstract. So some of the journals and conferences these days do require you to give a video abstract. Similar to the visual abstract or the graphical abstract that we had discussed, a video abstract is also something that can have wider reach through social media. Usually video abstracts are shorter duration videos, usually for 2 minutes and 20 seconds or less. The video abstracts should be made optimal so that they could be shared on social media. One of the key aspects of a video abstract is that it has got a personal touch. The authors themselves get a chance to introduce the readers to the research work about which they are passionate, and then they are able to induce the readers to read the full manuscript pertaining to their research work. At the end of the section on abstract writing, I leave you with these key take-home messages. Abstract writing may be harder than what you have imagined because succinctly summarizing a larger piece of research work within 250 to 300 words is not an easy task. So systematic preparation and iterative writing, rewriting, and revising are key to writing a good abstract. Finally, let us move on to the final objective of today's lecture, that is to list relevant keywords for your manuscript. So what are keywords? Keywords are nothing but short words or phrases that are used for the purposes of cross-indexing and retrieving your data. If you're using appropriate keywords, then it becomes very easy for your manuscript to be retrieved by any person who is finding out relevant articles in the area of your research in indexing databases like PubMed and Scopus. The number of keywords that you write for your manuscript should be usually limited to 3 to 10, and they should revolve around the key concepts that your manuscript deals with. Always, it is a good practice to write keywords based on the medical subject heading words that you can get on the National Library of Medicine website. Arrange the keywords in an alphabetical order. For example, in a study, the keywords were celiac disease, children, clinical features, histopathology findings, nutritional status, signs and symptoms. If you would take a minute and go through these keywords, you will be able to understand what this research work is all about, and you could possibly also frame a title for what this research work could be. If I attempt to do this, then the title could be something like this: Celiac disease in Indian children, assessment of clinical, nutritional and pathological characteristics. So understand that keywords are nothing but 3 to 10 words or phrases that revolve around the main concepts of your research work, that should also preferably be the medical subject headings of the NLM database, so that your manuscript is properly indexed and can be easily retrieved when anyone searches for research work. In this case, if anybody is searching for research work pertaining to celiac disease, then these keywords would ensure that this manuscript also pops up in the results that the database gives you for your search. So to summarize, in today's lecture, we have been looking at how to write title, abstract, and keywords for your manuscript. As a result, the title, abstract, and keywords need to be appropriate to your research work, and also they should be concise and precise. This would ensure that your research work is easily retrieved by anybody who is searching for articles related to your area of research. That is all that I have for you in this lecture. I wish you all the best for your manuscript writing.